the first speaker in this journey today will be the renowned Dr. Irfan Qureshi from Pakistan. He is a practitioner in Karachi with his MSc in prosthodontics from the King's College, a diplomat of implant dentistry from the Royal College of Surgeons in Edinburgh, a diplomat and an ambassador of ICOI, a fellow of IDIA and WAUPS. He is the practitioner who didn't stop his practice even for a single day throughout the pandemic. So, right from the horse's mouth, you will hear how dental practice in the COVID era has evolved. Welcome, Dr. Irfan Qureshi.
Thank you, Dr. Puneet. Everyone can hear me, just checking?
Yes, sir.
Excellent. Okay, thank you for the opportunity to the organizers, especially Hashim Bhai from Dental News Pakistan, for giving me the privilege to share a stage with such illustrious colleagues. I'll get straight to the point now. Okay, so this is stuck right away. Okay, yeah, there you go. So I'll get straight to the point. Life was simple. We were going about our normal lives. And one day, we wake up and the world has changed. And we all know that COVID changed the world. And there's a lot of talk about the new normal. And my 2 cents about this new normal is we really have to ask ourselves a question, hand on heart, and reflect. Were we really truly following what was supposed to be the old normal? And if you think about it, the new normal is only very slightly different from the old normal. There's a lot of dentists who have been culprits for a transmission of disease among patients, and especially in the third world where there is very less accountability. So we learned the hard way. Dentists were also not spared when coronavirus struck. And we learned the hard way. We had to really face closure. A lot of offices all over the world were closed down. And there was an economic toll that was taken on the lives of dentists. And only then were we really forced to think on how to get out of this situation. So what did COVID-19 teach us? And I want to highlight this point. Viruses have survived millions and billions of years because of their ability to evolve. And as I mentioned previously, it's only now when we are pushed against a wall that we have been forced to think outside the box and think survival. So you have to stay one step ahead of potential disasters that will strike us even in the future. And the corona shockwave was felt around the world. There were burning questions. Should we be treating patients? And it was all over the internet, lots of content, and there was talk of treating only emergencies. Okay, fine, let's only treat emergencies. But what constitutes an emergency? I read a lot about, let's just treat uncontrolled bleeding, unbearable pain, and swellings, and call those patients to the office. But then try telling that to, say, a young lady who's knocked out an anterior Maryland bridge. Try telling her that she does not fall into an emergency and she should sit tight at home until things improve. So we couldn't really close down even for a single day. Something or the other was happening every day, and we used whatever we could get our hands on for personal protection, for the protection of our patients. And we stayed on duty trying to help our patients and be there for our patients. And once finally the dust settled, then we were able to sit down and think and formulate a protocol. We were also trolled a lot on social media for remaining open. There were lots of criticism. So how did we come about to this protocol and our approach? And I want to quote Arnold Schwarzenegger's trainer, Joe Weider. You have to be obsessed. A guy like me, who's a neurotic, so I actually have a field day because I'm going crazy. And we have a 3-pronged approach, ensuring personal safety for ourselves, safety of the premises, and ensuring that the patients feel safe with us. How do we achieve that? First and foremost is that the patients should feel safer at your practice than they even feel at home. I think that's a very important message. And for personal safety, the first thing that we do for all our staff members, doctors and staff included, is every single person who's coming to work has to get PCR testing done every 2 to 3 weeks if they want to work with us. And we all wear PPE suits, we're training and retraining, educating and re-educating our staff. We have discussions every day. I'm like a nagging mom running after our staff members, trying to tell them the importance of social distancing, not letting them eat together, not congregating together, avoiding non-essential travel, non-essential socializing, etc. So all of this, discussing diet, staying healthy, and we're not compromising on these. So I've hired people whose only job is to clean, sweep, scrub, wash, sanitize every hour and keep repeating it neurotically. If you're a clean freak, this time is Christmas time. Okay, go nuts. So we've installed air purifiers. We're using hypochlorous acid, which I will also talk about. Rubber dams, which is standard of care to begin with. Like I said, rubber dams was old normal too. And again, no compromise. So we're also talking to patients, educating them, restraining them diligently, and I will show you how we are doing that. How do we put all of this together? So I put together this little pictorial to show how we are doing this here in my office. This is our front desk area. It's a spacious front desk, and this is the receptionist. The patient experience starts when the receptionist calls the patient for the appointment. And what you see lying next to the coffee machine, this little guy, is an interesting device. It sprays a hypochlorous acid-based mist, which is very safe, and it's very helpful in decontamination. As you can see, it's controlled by remote. So the front desk guy will come and clean up everything. And on the bottom left of your screen, you see an air purifier, cute little guy right there. You can also see we've placed signs on the seating area where patients are not allowed to sit, and we're encouraging them to practice social distancing. So spacious waiting area, social distancing, and it's always very helpful when you have a pleasing, welcoming premises. This is the patio of our clinic. When the patients arrive, this is how they are welcomed. As soon as they enter, there is a guy just at the entrance who's fully covered, and he's holding his gear. He will help the patients to sanitize their hands. He will offer them gloves. Then a staff member will come who's also fully covered in 70 GSM PPE, and she will cover the patient in a 70 GSM sterilized PPE gown. So that's how it's done. And then a staff member will disinfect the door handle for the patient, and the patient then walks into the reception area where the receptionist will take the patient's temperature with a non-contact thermometer. And then he will even disinfect the pen that the patient will be offered to fill out her patient card. So it's attention to detail, small little things. And then the front desk receptionist will spray a disinfectant onto the seating area where the patient will sit. So all these things are very reassuring for the patients. And this is another COVID-19 related history form that we have designed in addition to all the other information that the patients fill out. And I'm happy to share this with the colleagues if they would like me to. So the patient is then escorted from the front desk to the surgery. And we have additional waiting areas in our premises also where we encourage social distancing. And these are also misted down, as you can see, with the hypochlorous acid. So when the patient enters the surgery, an assistant will spray a small basket, a nice looking small basket with a disinfectant, and ask the patient to place their personal belongings like cell phones and keychains. So again, the patients feel reassured. So these are our surgeries. From the start, because I was always a neurotic about hygiene and cross-infection control. So we made bigger surgeries, which were well ventilated to begin with, and they've been greatly helpful. And the surgeries are also, sometimes we run these mist machines in front of the patient. It's a nice dramatic effect also, and again, it reassures patients, makes them feel safe. And again, for reassurance of the patient, The assistant, who's also fully covered, you can check the attention to detail, armrest, etc., are fully covered with the protective tape. And the assistant will scrub the chair with the disinfectant before the patient is seated, and the patient is fully covered. And then, and only then, will the doctors wearing full covered PPE suits and the assistants wearing full PPE suits will proceed with treatment. We are using rubber dams. We were using them even in the pre-COVID era. And initially, we were using N95 masks, which were difficult to reuse and they were difficult to acquire. So we then switched to these industrial grade respirator masks, which have replaceable filters. We've also invested in these aerosol aspirator machines. And until they arrive, what is standard practice in the clinic is once the patient has been treated, once they leave the premises, the surgery is emptied out, windows are opened, and fans are running just to flush out as much aerosol as possible. Nobody goes into surgery for the next 30 to 40 minutes. So this is a very small pictorial of how we do things. We have additional 4 surgeries in the clinic as well. All surgeries are big rooms, ventilated, spacious, and they're also misted down, as you can see. Air purifiers are placed in each surgery, and the staff is trained and retrained every day. We nag them all day long to get used to this new normal. I just want to make a couple of last comments before I finish my little talk. What was very disappointing to see was what I call decay of humanity. The way our vendors, our suppliers, sellers were giving out and selling sanitizers, masks, gloves at exorbitantly high prices, and the way the situation was exploited was heartbreaking to see. This needs to be addressed. Another important aspect, which I personally also felt, is, dentistry is a difficult profession. There is a high prevalence of burnout among dentists, stress and anxiety. Even in the pre-COVID era, if you search the internet for publications, this is rampant among dentists because you're essentially in a career where no one wants to see you. Everyone who walks into your office tells you day in and day out that they hate being here, and you get to hear this every single day. It starts to play on the mind after a while. So, dentistry, the stress can kill you. And COVID-19 has not helped the situation anymore. And this is something which I feel that the dental community and colleagues and professionals can come together and really try to help each other in trying to manage our psychological health, our emotional and our mental health. So I leave you with this quote by Mother Nature. If you want to survive, if you want to thrive, you have to be willing to evolve. These are contacts where I can be reached on. Thank you very much for listening to me. And Puneet, I hope I have not overshot my time by too much.
Perfect. I think you were too good. In fact, I'd request you to stay online because there are a few questions pouring in for you. In fact, you have very nicely outlined that the clinic design has to be altered in order to combat the COVID infection. But there are 2 questions which have come up. First one is that do you have to modify the air conditioning, or are there some regulations? The ACs, I could see a wall mounted AC on your operatory. So what kind of air conditioning system would you prefer?
So this is an interesting question, and that was also put to me before the session. One suggestion was having negative pressure rooms. The problem with negative pressure rooms is that it kills the air conditioning. And in Karachi, the temperature this summer has gone up to beyond 40 degrees Celsius. And we're working wearing PPE suits. So until something concrete comes in terms of how to deal with air conditioning, this really is a gray area. What you can do is work around it. Like I said, go neurotic with disinfectant sprays, That's why we acquired these mist machines. And hypochlorous acid, by the way, is something that we need to read up a little bit on, because that apparently is helping in cleaning the environment. Air purifiers. I think, you see, there are hospitals, by the way, with centralized air conditioning plants, and they have these valves and ducts. And a lot of these WhatsApp messages are floating around that even these ducts can transmit the virus. I mean, by the way, having said that, I'll also tell you, in the last 4 months, and we have religiously been getting tested every 3 weeks or so, despite the fact that we're literally, we have our faces in the patient's mouths, none of us so far have tested positive. So, by the grace of Allah, I think we're doing something right.
Another question which has just popped up is regarding biomedical waste management. Your laboratories are very nicely designed. Any changes you've made to that? Because one of the viewer has commented that since you are making the patient also wear a gown, there's a lot of biomedical waste to be disposed of.
Absolutely. So, there's a question, it's a question that even I have been asking, and it's a question that we all need to ask. All these masks and PPE equipment which is being sold is not biodegradable, is it? So all this positive talk of lesser travel and lesser air pollution and the air clearing out, how is all this waste, billions of masks being sold, where are they all going to go? What we do is, I'll tell you to answer your question, we're actually quite fortunate. We're in a my practice is in a place called Clifton in Karachi, and we are right next to a hospital. And the hospital has an incinerator. So we have a staff of about 29 people in the practice. We are a big practice. It's a 500-yard premises with 2 stories. So we have a lot of staff for this. The PPE suits, by the way, are not reused. We don't even. There are a lot of people I know who are washing them and they're reusing them again. We get rid of them. So we get the hospital personnel to come and pick it up and use their incinerator to dispose them off. Now, we were doing this. We were not wearing PPE suits, to be honest, in the pre-COVID era, but we were using the hospital incinerator for our masks and our gloves, even pre-COVID. So like I said, really, hand on heart, ask yourselves, we've only been pushed now to be doing what we should have been doing all along.
Thank you, Dr. Irfan. I think while we have the panel discussion towards the end, we'll again connect with you.